My name is Andrea Franconia, and I have just completed my capstone project for RN-to-BSN program. And my project is on the effects of stress on nursing staff productivity and the use of yoga as a stress management technique. I'd like to start off by talking about the site where I completed my practicum. I went to the University of Kentucky Urgent Care Center / Twilight's Pediatric Clinic. It offers urgent care services to adults 7 days a week and all major holidays except for Thanksgiving and for Christmas Day. The Twilight Clinic offers after-hours pediatric care. It is only available at as a same-day appointment. It services anywhere from newborn to 17 years of age. An average of 60 patients are treated per day at the urgent care and pediatrics Twilight Clinic. I remember one of the days I was there doing my practicum that they treated close to 100 patients in a single day. The clinic is staffed on the floor by licensed practical nurses, LPNs, medical assistants, or MAs, and registered nurses, or RNs. The patients are treated by nurse practitioners in the urgent care clinic. Typically, there are 2 of them on staff. And as far as pediatric Twilight clinics go, those patients are treated by pediatricians. One of them is usually a resident and the other one is an attending. And the interesting thing I learned about the attendings there is that they are not general pediatricians. They are board certified in other specialties, including nephrology and infectious diseases. They moonlight at the clinic a couple of nights a week as a way to keep up their skills and experience with general pediatric patients who may not be as seriously ill as the patients they normally see in their practice. The University of Kentucky healthcare system made a big change in the summer of 2021 by changing electronic health record vendors. In the outpatient areas, they switched from Allscripts to Epic. In the hospital, it was Sunrise Clinical Manager to Epic. However, an important thing to note is that when Epic was rolled out, the clinic volumes were not reduced to accommodate the staff needing to adjust to the new system. This gave me the very unique chance to study the impact of stress in real time. Not only are the staff at UCC Twilight continuing to deal with a global pandemic, they've also had to change almost everything about the way they room patients, treat patients, etc. because of Epic. My learning objectives were as follows: to perform an assessment of staff stress levels prior to an intervention. I did this by emailing out a Qualtrics survey. I'll go over the data from that later in this presentation. I also developed a plan to educate urgent care staff about stress management and reduction with the help of my preceptor. My project involved an intervention and then a post-intervention survey. Again, the data and content of the staff education and the survey will be gone over later in this presentation. My third and final learning objective was to discuss techniques that can be used during stressful moments of a nurse's shift with my preceptor, because some of the stress management techniques that are in the literature for nurses are great, but they require you to be able to step away from your desk or the unit to be able to do them, and sometimes you can't always do that. I chose chair yoga as the intervention because that's something that's you can do as you're sitting and charting or sitting and waiting for the provider to give you orders for the next patient. And I also prepared learning materials for the staff about chair yoga. I think anyone who has worked as a nurse or in any type of healthcare job for any length of time can definitely relate to this little guy on my screen here when it comes to stress in the workplace. Nursing is a stressful occupation which can cause damage to physical and emotional health, something I think all of us are familiar with on some level. These feelings of poor physical and poor mental health, contribute to burnout, which is what is fueling the nursing shortages across this country, according to Hirsch from 2016. More recent stressors that nurses have undergone include the ongoing politicization of the COVID-19 pandemic and the spread of false information regarding the virus, according to Arnett's in 2020. I would also personally add that another contributing factor is the spread of false information about the COVID vaccine. This was just not included in the study because it was not available at the time that the study was published. Other stressors of nursing include shift work, which is applicable to the staff at UCC Twilight. They typically work 3 12-hour shifts per week, just like you would in a hospital. They are also required to work every other weekend, and there is also a holiday schedule that is filled out based on seniority. Heavy workload, I discussed earlier in the presentation how many patients are typically seen per day at UCC Twilight and at the pediatric clinic. Ill-designed jobs and work environments also contribute to stress, according to Hirsch. There's only one computer to print lab labels, and sometimes everyone needs to print lab labels at the same time at UCC Twilight. There's only one hallway, and sometimes we need 2 hallways to be able to fill up with the amount of patients, but with family medicine being right next door to UCC Twilight, sometimes utilizing that extra space is not an option. To compare experiences of stress with current literature, I designed a survey and emailed it to 9 frontline workers at UCC Twilight. I received 4 responses back to my surveys, which I feel is pretty good given the length of time that I was able to be there for this class. 75% of employees at UCC who answered the survey feel somewhat more stressed since the Epic transition began because a lot of processes and workflows did change, and because all of the training was done over Zoom, sometimes this was not communicated as effectively as it could have been in an in-person environment. 50% of those who answered the survey report psychological symptoms of stress, but only 25% reported physical symptoms. Yoga can be used as a best practice for self-care, according to a study by Hillcove from 2020. The practice of yoga focuses on body postures, breathing, and creating a meditative state. Regularly practicing yoga can create a moment-to-moment awareness. This can help decrease staff's feelings of being overwhelmed in healthcare settings, especially high-volume environments like UCC/Twilight. Hirsch in 2016 found that patient loads and staff schedules make implementing in-person stress management trainings difficult. This has been compounded by the COVID-19 pandemic. Social distancing protocols in healthcare settings can make in-person meetings impossible. As of recording this presentation, University of Kentucky Healthcare is currently on Tier 3 of its COVID plan, and this means that in-person meetings are only allowed during certain emergency circumstances, and the attendance must be limited to 10 people or less. Web-based programs can be just as effective as in-person ones, according to Hirsch from 2016, which is important for us at this time. Arnett's also stressed the importance of healthcare organizations giving nurses opportunities to discuss their stress and make workplace adaptations during the pandemic. The data I have just listed supported my intervention. I emailed a PowerPoint with 4 chair yoga poses and instructions on how to perform them to the UCC staff. The poses, I chose 2 that focused on lower body stretching and 2 that focused on upper body stretching. My post-intervention survey showed that 50% of staff felt, quote, about the same regarding both their productivity and their stress levels. I may have had a different outcome if more time had been available to include another department in the survey, such as family and community medicine, where I'm currently employed. Our schedules are different than UCC Twilight, and we don't have the same patient burden. Our family and community medicine doctors see at most 24 patients in a day. Our hours are strictly 7:30 a.m. to 5 p.m. weekdays only, no weekends or holidays. Reflections on my experience during my capstone project. There's excellent interprofessional communication and teamwork at UCC Twilight. There's always someone there to answer a question if you're not sure about something. The grand majority of the providers are very receptive to feedback from nurses, and they interact in a very respectful way for the most part. Excellent communication is essential to any nursing job, and at UCC Twilight it is especially important because they see patients where you will not be familiar with this patient's medical history 100% because it's not a primary care practice. And many of the patients that we have present with complex comorbidities. I remember one child that presented to the Twilight Clinic who also sees nephrology and a couple of other specialties for some various medical issues. But this patient was having an issue, and they were not able to get into a specialist or get in to see their pediatrician because it was after hours. So their parents brought them to UCC Twilight. And the communication styles never varied. It was always done very professionally. And it didn't matter if it was a very complex patient who may end up having to be referred to the emergency room for further evaluation and treatment, or if it was something simple that we could handle in the office without needing to refer them somewhere else, such as a patient who was exposed to strep at daycare and they need a strep test to see if they pick that up, or if someone cuts themselves while working in their garden and they need to have stitches. It was a valuable opportunity for me to learn more about pediatric nursing. I work at UK's Family and Community Medicine Department, and while we do accept pediatric patients, many of the parents choose to instead bring their children to the specialty clinics designed for pediatric patients, either at Kentucky Clinic South or at the University of Kentucky Children's Hospital clinics, depending on the patients. My professional background is I came from adult psychiatric settings and adults only correctional settings. My preceptor was an invaluable resource about pediatrics. She used to be a pediatric intensive care nurse at Kentucky Children's before she transitioned to her role at UCC Twilight. My project encompassed many of the requirements of the Capstone learning outcomes, such as it applied the scope of generalist nursing practice. I integrated skills and values from the arts and sciences to provide humanistic quality care, specifically the art of yoga and the science of conducting peer-reviewed research. My use of Qualtrics to distribute and design the survey demonstrates skill in using information systems, and the project was also an interprofessional collaboration. I distributed the survey to RNs, LPNs, and medical assistants as well. And just overall, it was a very enjoyable experience. I had wanted to be an emergency room nurse when I first graduated. Life and my career took me down other paths, so this was a really good opportunity for me to be in that kind of environment again and learn more. And maybe at some point in my career, I will be able to go to transition to either an urgent care full-time or an emergency room setting full-time, depending on what the future holds. These are my references. Thank you very much for taking the time to watch my capstone project.